Okay. Hello, everyone. Good morning to those of you on the West Coast. Good afternoon to the rest of us. I'm so glad to see you all have been able to join us. Let me orient you really quickly. We've got a chat feature. You can chat to Miriam and me with it. And we also have a Q&A feature. And I'll talk a little bit more about that in a bit. All right. Welcome to the Black AIDS Institute's Brown Bag Lunch. All right, we're so excited that you're able to tune in. My name is Tanisha Lewis, and I am BAI's Senior Manager of Training and Capacity Building. BAI's mission is to stop the AIDS epidemic in Black communities by engaging and mobilizing Black institutions and individuals to confront HIV. So we advance this mission with activities like these brown bag lunches. And every single month, we're bringing in people who can speak to HIV related issues facing Black Americans. Today, I am so happy to introduce BAI's Biomedical Research Training and Education Program Manager, Myriam Johnstone. In honor of March's Women's History Month, Myriam is going to share the latest scientific information that comes out of the recent CROI conference from women scientists, as well as information about navigating this COVID pandemic and everything that comes with it as a woman. So feel free to also check Myriam out every single Wednesday on our Instagram and our Facebook at Black AIDS. And I'll put that in the chat in a bit, where she's answering community questions about COVID-19 and the latest vaccine research. So with that being said, we're going to turn the session over to Myriam. Please feel free to ask questions using that Q&A feature, and we're going to have time to get through most or all of them following the presentation. Myriam, it's all you.
Thank you, Tanisha. Good morning and afternoon to everybody here. Thank you for making the time to sign on and for your willingness to learn something new with me today. My name is Myriam Johnstone, and as Tanisha said, I am the Biomedical Research Training and Education Program Manager at the Black AIDS Institute. Let's get started with today's presentation, GirlStrong, leading the fight against HIV and COVID-19. All right, so during this presentation, I will be highlighting just some of the incredible HIV and COVID-19 research presented at this year's conference on retroviruses and opportunistic infections, also known as CROI, which took place earlier this month. The terms retrovirus and opportunistic infections refer specifically to HIV and hepatitis viruses like Hep A and Hep B, COVID-19, and other infections caused by viruses and the conditions that relate to them. It is a forum for basic scientists and clinical investigators to present the research they are working on to one another, to discuss the research, to critique together for the sake of moving the science forward faster. Every science experiment has something in common. It begins with an observation, something you're seeing happen over and over again, and it makes you wonder, is there a pattern here? An observation leads to a question, which leads to experiments. And it is these experiments that teach us about the many layers that our initial observation can contain. Experiments allow us to put numbers on the issues that may appear clear to us in our daily lives. My intention with this presentation is not only to highlight relevant research from this year's CROI conference, but also to honor the important work done by female scientists, work that is shining light on the many layers of COVID-19 and HIV in America. In 2017 and 2018, women of color earned 14.1% of bachelor's degrees across all science, technology, engineering, and mathematic fields. Asian women made up 5.3% of this group, Black women made up 2.9%, Latinas made up 4.3%, and American Native and Alaska Native women made up 0.1%. In my personal experience as a previously undocumented Peruvian immigrant, my passion, drive, and hunger for research was born out of a necessity to survive. It came from this deeply rooted need to make sure that I knew exactly what medical procedures were being applied to my body and to the bodies of the women in my family, especially my mother. Science and research is a lifestyle that drives us to ask questions. Here is an overview of what we're covering today. So we will review 3 studies regarding COVID-19 and HIV written by Jessica Islam, Adriana Shapiro, Eileen Sullivan. And we will also review 3 studies regarding pregnancy and family planning, written by Manas Sabata, Sahar Sangene, and Jian Sabood. For the sake of this presentation, I am only highlighting key findings and conclusions from all of these studies. However, if you want to dive deeper into them, let us know. We can send you a copy of today's presentations with the researchers' names and their corresponding study titles that we'll be covering. And finally, at the end, we'll have a little time for questions. The time in which we are living makes it nearly impossible to talk about COVID-19 without talking about HIV. So much of what we know about COVID-19 and the strides we've been able to make in terms of vaccination is thanks to everything we did to learn about HIV. Naturally, this has led to research about how these two viruses are coexisting and impacting marginalized communities during this, for lack of a better term, horrible period of time in human history. All right, so we're going to start off with Dr. Jessica Islam, who presented on racial disparities in COVID-19 positivity among people living with HIV in the US. This study included 17,820 adult people living with HIV. Its purpose was to see if minority groups of people with HIV in the US were more likely to become infected with COVID-19 than white people. The findings of this study were that COVID-19 positive people living with HIV were in fact more likely to be Black and Hispanic. The conclusion was that Black, Hispanic, and Asian adults living with HIV are indeed more likely to be COVID-19 positive compared to their white counterparts. Dr. Adriana Shapiro presented COVID-19 and hospitalization in people living with HIV in the US. Her study sample included 15,969 adults living with HIV who were actively receiving HIV care. This took place in the US, and its purpose was to figure out if people living with HIV were experiencing higher rates of COVID-19 positive tests and if they were being hospitalized due to COVID at higher rates as well. The findings of this study showed that more than half of people living with HIV who were hospitalized for COVID were Black. Findings also showed that only 3.6% of people living with HIV were testing positive for COVID-19. And this immediately sets off a red flag. What this tells us is that there is a gap between COVID testing and what we are actually seeing in hospitals, which raises a larger issue about whether or not people living with HIV have proper access to testing. And this is what the study concluded. Dr. Eileen Sullivan presented sex-gender differences in testing, presentation, and outcomes of COVID-19. This study sampled about 213,000 adults in the US. The findings showed that females were hospitalized due to COVID-19 5% less often than men. Females and males had similar COVID-19 test positivity rates, which means that females and males are equally as likely to get COVID. The study concluded that females were less frequently admitted to the hospital after a diagnosis of COVID infection. Females also had fewer breathing complications and overall severity of COVID-19 disease than males. To sum up this section, I want to share the CDC's data on COVID-19 and race disparities. As we can see in the table here, Black or African American folks are 2.9 times more likely to be hospitalized due to COVID than white folks, and 1.9 times more likely to experience death due to COVID. Latinx communities are seeing a similar ratio in that they are 3.1 times more likely to be hospitalized due to COVID than white folks and 2.3 times more likely to die due to COVID than white individuals. The CDC reports factors that contribute to this increased risk that we're seeing in this table, and they credit it to discrimination, healthcare access, occupation, educational, income, and wealth gaps, and housing. It is critical that we are aware of racial disparities at all times, but even more so during a pandemic. This allows us to provide equitable care that considers the needs of all the members of our communities. All right, so now we're going to dive into studies regarding pregnancy and family planning in the context of HIV and or COVID-19. Manasa Bada presented disparities in family planning among women living with HIV. Her study sampled a group of 737 women living with HIV in the US. Their findings showed that only 31% of women living with HIV used contraceptive products, so birth control. They also determined that younger age was associated with with an increased risk of pregnancy and lack of contraception use. The conclusion of the study was that most women living with HIV did not use any contraception at the start of the study or throughout the study, which lasted 4 years, thus identifying a need for more effective birth control counseling among women with HIV, particularly younger women. Dr. Sahar Sangane presented pregnancy rates and clinical outcome comparisons among women living with HIV. This study sampled 869 women living with HIV in 6 different countries: the US, Brazil, India, Malawi, Thailand, and Zimbabwe. The purpose of this study was to see if there were major differences in the health of women with HIV who had babies and women with HIV who did not have babies. Dr. Sangana and her team observed how many women in each group developed AIDS and STI infections, among other measures that they tested. The conclusion was that clinical outcomes were similar between women living with HIV who were pregnant and women living with HIV who were never pregnant. So they didn't see much of a difference. And finally, the study we'll be reviewing today was presented by Dr. Jan Saboud, titled Pregnancy Outcomes of Women Positive for COVID versus Women Tested Negative for COVID. This was a smaller study that documented the health outcomes of 123 pregnant women in the US. The findings showed that hospitalization rates were in fact higher for women who were testing positive for COVID-19 compared to women who were testing negative. They saw that 41.8% of women who tested positive for COVID were hospitalized, while only 21.5% of women who were negative experienced hospitalizations during their pregnancy. Preterm birth was also higher for women who tested positive for COVID. The rates were 30.2% for women who tested positive and only 13.3% for women who had tested negative for COVID during their pregnancy. The study concluded that in symptomatic pregnant women who tested positive for COVID-19 compared to negative patients with the same characteristics, COVID-19 infections seemed to increase preterm births, so early labor. My call to action this morning is really simple. I want to ask you to embrace the idea that the future of science is female, to realize that as a scientific community, we need more female researchers. We need more female researchers of color. We need the unique perspective and skill set that they bring to the table, the angles to issues that only they may be able to see and transform into measurable data. Raising a generation of scientists at an early age requires support. So keep your eyes open, encourage, motivate, uplift, and inspire. Thank you all for joining me today. Again, my name is Myriam Johnstone, and this is what we do at the Black AIDS Institute. So now we'll open it up to questions. Please ask your questions using our Q&A feature, and I will answer them to the best of my ability. Thank you.
Hey, Myriam, while we're waiting on folks to chime in with their questions, could you tell me which of these studies stood out to you the most and why?
I think that the study that stood out to me the most was probably the study that involved a comparison between women with HIV who had children and women with HIV who did not have children. I think I was pleasantly surprised to see that there wasn't worse health outcomes if you had children while having HIV. As a recent mother, I recently, like I said, recently became a mother. Um, there's just so much going on. I can't even remember to take my daily vitamins. I can't remember to take anything that I really have to take. Life gets so overwhelming when you have children. And I was pleasantly surprised to see that it didn't impact the development of AIDS in these groups of women. And it didn't impact the development of STI infections in these women.
I love that. So that right there is screaming messaging to me for any of us who's working out in the public health field and who are working on the ground with folks who are dealing with HIV. So what would your advice be, or what would you tell somebody who's working with people every single day with respect to that particular study? What kind of messaging and encouragement can they give the folks who with whom they work?
I think that we are at a point in the history of HIV and AIDS where you can really live a full, complete life. Like you can do everything you ever wanted to do, regardless of your status. And that's what's exciting to me. And I think that's the message we need to get across to people is that this is not going to inhibit you anymore. You know, you can have babies, you can thrive, you can live a long life. And I think that's the message that should be spread.
I love that. So, for those of you who haven't had a chance to tune in to Myriam each Wednesday, Myriam does a Wake Up Wednesday session where she talks about COVID-19 and its impact on the Black communities and overall disadvantaged communities in general. So, Myriam, last time you focused on COVID-19's impact on women and girls, and today you focused on the impact that COVID-19 and HIV has in these latest findings. So, I'm wondering, what information do you have to share with us, those of us who identify as women who are just trying to make it, trying to navigate this pandemic, and some of us who are navigating this pandemic in an epidemic situation dealing with HIV positivity? What message do you have to share with those of us?
Honestly, I think that self-care is so essential. And it's something that we often put on the back burner. And it's something that, I mean, all of these Instagram pages about moms and everybody are constantly reminding us to do. But the only way we can maintain our sanity and make sure that we are not only prioritizing our health and our mental health and our well-being while we're caring for our children, caring for elders in our homes, caring for our families, is by also prioritizing self-care. And that can be as simple as like a walk around the block once a day. And it's something that I am recently incorporating into my life. And I highly advise people to incorporate into their lives too, because I mean, we're doing good with COVID right now in the US, but God forbid there's another wave, you know, and we're for sure stuck in our homes again and we start losing our minds. So yeah, self-care.
I love that. And so I identify as a woman, and I know it's hard maintaining the household, maintaining a full-time job, maintaining a family. You know, that's difficult. And so that's really helpful advice that you give. We have a question, and someone asks, why do you think that women are less likely to have a serious case of COVID-19 to men?
All right, so I can't speak on the exact reason why, and I'm not even sure that the scientific field really knows why this is. I think we're trying to draw correlative patterns between what women might have and men don't have and why it's less. But when COVID first happened, they started doing these tests on mice, right? They started comparing male mice and female mice and giving them COVID and seeing how they responded to it. And for some reason, women are not experiencing as severe symptoms as men are. I think that as time goes by, the science will continue to figure out more and more reasons why. There's ideas of why, but we honestly don't know yet.
Right. I'm sitting here trying to think of some social implications, but women and men are just as equally likely to work in these essential positions. And gosh, I just don't know. I think we just have not enough information. Like you said, this is such brand new research. It's changing all the time. And we have another question. Someone asked, as men in the field, based on the studies shown, are there some tactics or tips that you can provide in helping men identify properly assist women who are navigating COVID and HIV? So having folks who identify as men be allies to women navigating COVID and HIV.
That is such a good question. I honestly wish that every man in my family asked me that question, but I've never been asked that question before. So I have to think about it. I think that, I guess personally, the way in which I would feel most supported and feel as though we can create a sense of allyship is if you treated me like an equal. If you treated me as an equal. And I think that that's something that people think they're doing, but usually you're not. So I think that if you actually were intentional in listening to me as closely as you listen to your male friends, your male colleagues, right? I think that would make a difference.
I completely agree. And also just making space and asking, how are you doing? How are you really doing? And then listening. Sometimes my husband does one of those things where he asks me, how am I? And then I go to tell him and I can just see his eyes glaze over a little bit. So actually just listening, really listening and responding. All right.
You
So
know
we,
what, Tanisha? And not talking over me. I think that would make a huge
right.
difference.
All right. Someone says maybe women are just tougher in response to the other question about serious cases of COVID-19. That's funny. That's a good one. All right. So we've got another question or two or three or four as I'm counting. All right. It's a four-parter. So I'm going to give it to you all at once, and then I'll read again the first question for you. All right. So we've got today, what is the biggest reason why women are not talking about HIV prevention? Is it still awareness, stigma? What is the best way to raise awareness among women about HIV and their high risk? Is it with their family, friends, or Dr. OB-GYN? All right, so I'll start again with that first one. What's the biggest reason why women are not talking about HIV prevention? And I guess that leads into the other questions too.
That's a really great series of questions. And I think that I can answer it and kind of encompass it. So I honestly, from where I'm sitting, from where I'm watching things happen, I think it's awareness and I think it's stigma. I think you're right on it. I think that it's something that we just don't talk about. It's something that isn't talked about in social media. It's something that isn't talked about in the media. It's something that we don't see often, right? So because it's not something that we see often, we think it's something that doesn't pertain to us. And that's the biggest issue is that there's this huge discrepancy and we think that we're not at risk when in reality we're just as much at risk of getting HIV as we are of getting any other STI, right? But that's not something that's talked about. And I think that the way we begin to combat that is by you talking about this in our daily lives. Talk about this with the women in your life. Talk about this with your family. Talk about this with your doctor when you go in for a checkup. Talk about it because the more we talk about it, the more that people around us become informed. And sometimes we think like, oh, like you're in a group of friends, you assume that they know these things. And the reality is that they don't. Like, there's some basic things about COVID-19 that I was under the assumption that many of my friends knew. And I've hung out with them and they're like, have no idea what's actually the fact of the situation. So the more we talk about this, the more we normalize it, the less we criminalize it, and the faster we can get rid of the sense of stigma that is preventing us from being more effectively protected.
That's a great response. And it made me think about something too, Myriam. That stigma that we have. So, as women, a lot of times, many of us feel we have to be super women. And so, there can't be anything that makes us seem lesser than. And there's a stigma around HIV that there is something wrong, that there's something wrong with you, something wrong that you did socially. And that's just not the case. And we need to, just like Myriam said, continue to talk to each other about it and normalize these things. All right. We've got to know that there is nothing wrong with any of our decisions, any of our choices. We are who we are, and we don't have to go around trying to pretend to be perfect superwomen. We are perfectly superwomen in our imperfection. And so, yeah, I agree to continue to raise that awareness among family, friends, and then in your physicians. And then also, especially in the Black community, we have what's known as credible messengers. So those are like your faith leaders, educators in their community, pillars of the community and really leverage those folks too to spread the information. That's how a lot of us get our facts. Are there any other questions? These have been really, really good. All right. So if there are no other questions, we're going to start to wrap it up, just trying to give folks a little time to type if they've got one burning question left. Okay, if not, so that does it for this week. Please be sure to check us out for these webinars every fourth Thursday. We're going to be here at 11 a.m. Pacific time, and I believe that's 1 p.m. Central, and it's 2 p.m. Eastern, my time. And you can stay updated on our events by following BAI on Facebook, Instagram, and Twitter. It's at Black AIDS. And you can subscribe to our website, blackaids.org. I want to thank Myriam for joining us. This is the second time Myriam has joined us, and she's been stellar each time. Once again, my name is Tanisha Lewis, and I'm the Senior Manager of Training and Capacity Building at the Black AIDS Institute. If you would like a copy of the slides, please just email Myriam, and Myriam can throw her name in the chat. You can also find the both of us online at blackaids.org if you have any questions or would like more information regarding today's session. You can also, in a few days, check out today's BBL on our YouTube channel. And then last month's is already there, and it's got the same handle, at Black AIDS. I'm wishing you all a wonderful end to your week. I pray that you stay safe and that you are all well. Thank you so much.